Hello, all. Assalamu alaikum. I am Akshay Kumar, and today I am here to discuss about my topic early and progressive rheumatoid arthritis. So, here is the introduction. First of all, you have to know that what is rheumatoid arthritis is. Rheumatoid arthritis is basically an autoimmune disorder in which body itself made antibodies against its own cells by an unknown mechanism, due to which an hyperactive inflammatory response is produced, which leads to bone and joints destruction. It is most systemic inflammatory disease which is characterized by symmetrical joint involvement. Epidemiology of rheumatoid arthritis. It tells about that how many world's population is affected, how many men's, women's is affected by rheumatoid arthritis. It mostly affects the females. If we see the ratio, it it is 3:1. Means 70% of female is affected than male. Nearly 1% population of world is affected by rheumatoid arthritis with females. Nearly 5% of women and 3% of men over the age of 65 are affected. It can develop at any stage of life. Etiology and pathophysiology. It tells about that how it basically affect our body, how what is its mechanism. Many environmental influences like smoking or any other antigen which can lead to the trigger of autoimmune system and make the bone destruction. Other is genetic markers. It has small role rather than environmental influences. Then main is the antigen dependent activation of T lymphocyte and tumor necrosis factor alpha, interleukins 1, 6, 8, and growth factors. Mostly it's process that APCs, which is antigen presenting cells, are involved in the destruction of joints and bones, and also beta cells. Beta cells and APCs both activate T cells, which leads to activation of macrophages and production of cytokines. Cytokines which are involved in these processes: tumor necrosis, factor alpha, interleukin 6, interleukin 7, and other than expression like nuclear factor kappa B is also involved in this process. These all cause the of osteoclastic changes in the bone, due to which bone activity destroyed and bones resorption occur. Also, uh, the inflammation of synovium cavity of joints occur. Signs and symptoms which tells about the rheumatoid arthritis is that a person has the morning stiffness like for an 1 hour or less than 1 hour, and swelling in joints, hand joints, somatic joint swelling, are the if we take an X-ray of hand or the other like small bones, it tells about the bones erosion. We see bone erosion in these X-rays, and also the rheumatoid nodules which occur on the basically elbows like nodes. It is an abnormal serum RF factor. RF factor is rheumatoid factor, which is present for at least 6 weeks for the characterization of rheumatoid arthritis. Basically, rheumatoid arthritis is of two types. Uh, One is that articular rheumatoid arthritis, in which small joints are inflamed, like hands and toes, and an extra-articular rheumatoid arthritis, in which it also affects and other organs with these, like rheumatoid nodules, which occurs on elbows and bone, also affects on pulmonary system, due to which many pulmonary complications can occur, like peripheral effusion, fibrosing alveolitis, bronchiolitis, and also affects on the ocular system of the body, due to which many other disorders can occur, like episcleritis, scleromalacia, Sjogren syndrome. It it affects more on the cardiac system of the body, due to which many disorders can occur, like pericarditis, endocarditis, myocarditis, coronary vasculitis, and it also due because it is an autoimmune disorder. That's why it also affect on the blood, due to which many disorder of blood can occur, like anemia, neutropenia, thrombocytosis, and many neurological problems can occur, like cervical cord compression, peripheral neuropathy. Then we see that how rheumatoid arthritis may progress day by day. What is the stages of rheumatoid arthritis? Many, if we see that, if this is many, in many cases, it is long time. For long period of time, it can occur, and sometimes its symptoms can persist, and sometimes can go. Mostly happen about 15% people with rheumatoid arthritis have this type of progression, like symptoms comes and then vanished, and after that it also progressive rheumatoid arthritis, in which situation need long-term treatment plan and coordinate medical team to manage the condition and slow or to stop from getting worse. There are mostly four stages of rheumatoid arthritis progression. First stage, it only affects the the inflammation of the joints lining or synovium become inflamed. Not much hurt the bones or damage the bones, but tissues around the bone swells. That's why joints become stiff and painful. Stage 2 is a moderate stage in which cartilages are damaged, which holds the bones in, and joints then become stiff, and the motion also become much less or likely to stop mostly. At stage 3, this is severe stage in which inflammation of cartilage, in which cartilage mostly lost and the erosion of bones occur near the joints, which due to which joints become unstable and might start to notice deformities as bone move around, and the patient feels pain, swelling, and might loss of motion. Stage 4, the last stage of progression of rheumatoid arthritis, in which inflammation stops but the damage continues, because there is no lifetime treatment for this. The joint might stop working, or will have to still have pain, swelling, stiffness, and lack of motion, where muscles may be weak too. It could be time for joint replacement and surgery. Diagnosis: how we diagnose the rheumatoid arthritis. These are the several tests, these are the several values which tells us about the rheumatoid arthritis. Like in morning, if patient feels stiffness and its duration is about 1 hour or more than 1 hour, and the symptoms persist for 6 weeks or less than 6 weeks, and if a person a threat and if persons more than three joints or three more than three bones are affected, like soft tissue swelling or exudation, and it persists for 6 weeks. After that, arthritis of hand joint, in which risk metacarpopharyngeal joints lasting more than 6 weeks, and symmetrical arthritis at least one area for less than 6 weeks or equal to 6 weeks. After that, the rheumatoid nodules, which are observed by physician, and serum rheumatoid factor, which is Rh factor, which is if less than 5, radiographic changes, which are seen by X-ray or MRI. If four of the above criteria are diagnosed in a patient, then a person is called a patient of rheumatoid arthritis. And further tests by which we see the patient that it's a patient of rheumatoid arthritis is some hematological tests like erythrocyte sedimentation rate. ESR helps determine the degree of inflammation in the body. If, however, it doesn't indicate the cause of inflammation, but if ESR value is high, then we say that person have rheumatoid arthritis, and beside this, anti-citrulline antibodies, anticyclic citrullinate peptide antibody, which is also called as anti-CCP antibodies. By this anti-CCP test, it tells about the antibodies usually have the disease. However, not everyone with RA test positive for this antibody have rheumatoid arthritis, but mostly we use this anti-CCP test for the diagnostic purpose of rheumatoid arthritis. And besides this, also C-reactive protein test, which is a severe infection or significant inflammation anywhere in your body can trigger your liver to make C protein. High level of this inflammatory marker are associated with RA, rheumatoid arthritis, and also rheumatoid factor test, which is RF blood test, check for protein called rheumatoid factor. High level of rheumatoid factor associated with autoimmune disease, especially rheumatoid arthritis. Then after that, what is the treatment for rheumatoid arthritis? Mostly first line is first we have to decrease the pain, for which we give NSAID will decrease the pain, but it doesn't slow down the rheumatoid arthritis progression. And NSAIDs like aspirin, ibuprofen are the drugs which are used for the pain suppression. For the stop progression of rheumatoid arthritis, we basically use DMARDs like methotrexate, sulfasalazine. DMARDs also decrease the inflammation and the progression of the disease. DMARDs have two types. One is conventional, in which include methotrexate, leflunomides, and sulfasalazine, hydroxychloroquine or chloroquine. It basically reduces the progression of rheumatoid arthritis by suppressing the autoimmune system. After that, if patient doesn't uh, have if we doesn't see any improvement, mm, after using DMARD, then we switch to the Biological agents are, we say that biological demands like infliximab, abatacept, rituximab. After biologics, we have another recently introducing class like J kinase inhibitor, like tofacitinib. It is mostly used nowadays. And after that, we also some side effect of these drug, uh, like if we use conventional DMARD, it has some side effect like dyspepsia, nausea, vomiting, hepatotoxicity, and the problem related to biological DMARDs is that it increases the risk of infection. And if a person is taking methotrexate, then it should have to take folic acid with this. And if we give a leflunomide to patient, it is then we check the hyper. Then we check that if patient is not a have not a history of hypertension, ulcer, or GI or liver disease, because it its adverse effect is hypertension. And if we give sulfasalazine, then we start with low doses because it has also a serious side effect. All these DMARDs have a common side effect like it causes the tuberculosis and also increase the risk of cancers. Tofacitinib or monoclonal antibodies. It also increase the cholesterol level, but not as much as that there is a risk of atherosclerosis or cardiovascular disease. But patients which are suffering from the metabolic disorder, then these drugs are avoided because it can cause hypersensitivity reaction in the patient which are hypersensitive. We also use combination therapy to minimize the progression of rheumatoid arthritis. Then we discuss case study to understand the rheumatoid arthritis. Like a 32-year-old male patient was admitted in a hospital on 29 January 2012. His chief complaint is that he has fevers and severe headache and joint pain, muscle pain, fatigue, and loss of appetite. And the history of patient tells that these symptoms are going from the 30 days, and it's also as throat pain. Physical examination shows the body temperature like 100.4 degrees Celsius and its pulse rate is 92 per minute. Blood pressure is 110, and we also do some lab investigation in which we see that the RBCs 4.7 million per cube, and ESR is also high, which is 59 per hour, and blood sugar is also 92 milligram per deciliter. So these we are beside these we also take some other tests like patient's chest X-ray, E-reactive protein test, or anticyclic citrullinated peptide antibodies are found. Radiographic examination like X-ray shows the rheumatoid nodule found. So these we tells that patient have diagnosed with rheumatoid arthritis and acute bronchitis. Then we have a sub notes of the case study which we discussed earlier, like subject line in which we tells about the patient is like 32 years old male patient, and what is his chief complaint like fever, headache, joint muscle pain, fatigue, loss of appetite, and the cough with expectoration for 30 days and throat pain. Objective what we see from the physical and the tests which we conducted in lab earlier discussed, like the increase of ESR shows that he has rheumatoid arthritis, and the chest X-ray abnormalities also show that he has rheumatoid arthritis and the bronchitis. Assessment, for this we take assessment based on above laboratory finding. Patient was assessed that he has rheumatoid arthritis and acute bronchitis. Plan for this is the patient treated with the following drug like ceftriaxone to treat bacterial infection, and plan to reduce acidity, levoflox to treat bacterial infection, and montelukast to treat asthma. Nebulizer Dolin is act as anticholinergic and antiasthmatic for the bronchitis, and ipavant is an anticholinergic drug, and we give decadron to reduce its inflammation. There are also some drug interaction like injection pen increase the level of effect of montelukast, or it cause increases calf tendon rupture with glucocorticoid, or it increase the theophylline toxicity with quinolone antibiotics, and it also cause the increased toxicity with other anticholinergic drugs. Then what a pharmacist suggests to the patient? Pharmacist may suggest that the a patient should take rest to release stress on inflamed joint and prevent further destruction, and also occupation therapy to increase mobility, physical therapy to maintain mobility, and also some kind of devices like canes, walker, and sprints, and also reduce weight to in order to alleviate inflamed joint stress. And we also do patient counseling, like it should take physiotherapy at regular intervals and avoid to allergies and dust particle and regular physical and breathing exercise. And it should not take heavy lifting or heavy weighting, because it can affect the bone joints. Thank you.